Thank you so much today for being with us as we talk about Best Starts for Kids Prenatal to 5. My name is Marcy Miller, and I'm the Best Starts for Kids Strategic Advisor for Help Me Grow.
And I'm Victoria Lynn. I'm the Best Starts for Kids Prenatal to 5 Policy and Program Manager.
Together, we've been partnering to ensure that the Prenatal to 5 strategies fit in one cohesive system, and we're working closely with content leads to support this work. So much credit for this work goes to the community for supporting the strong thinking behind all of this work, to our Children and Youth Advisory Board, and to many individuals who are leading the work here, each strategy here at King County. So why are we here today? We wanted to respond to community feedback to ensure that we get the information you need to stay up to date on Best Starts for Kids and understand what future funding opportunities are. We also wanted to ensure that there was transparency about how decisions are being made for funding decisions. And we also know not everybody can travel, and it's hard in our busy schedules. So we wanted to ensure that the webinar, to put forth a webinar so that you were able to avoid traveling. And this can be recorded so that you can share with many participants moving forward. So what are we going to cover today? We're going to talk about the high-level overview of where our prenatal to 5 work fits in. We're going to cover our approach and our journey for thinking about our equity and social justice. We're going to talk about specific funding opportunities and a summary of what it is, why are we doing it, and think about share the timeline and eligibility and how decisions are being made. We also are going to talk about data and evaluation and think about and share how you can stay connected to the ongoing work for Best Starts for Kids. So you have the capacity in today's presentation to share this over a blog. If you're joining us on the phone today, we can unmute you at the end and you can ask your questions. And we'll pause throughout the presentation to answer specific questions you may have. So if you're joining us on your computer, feel free to enter your questions into the chat box and we will get to them.
Great. Thank you, Marcy. So first I wanted to provide a high-level overview of Best Starts for Kids. We have a really simple vision. We want to see more babies be born healthy, more children thrive, and more young people grow up to be happy, healthy, and successful adults. It's a pretty simple vision, but it also happens to be the most comprehensive approach to child development in the entire nation. So how are we going to do it? So much of public policy is focused on crisis management and punitive measures, and what we wanted to do is something different. We wanted to increase the good, decrease the bad, and intervene as soon as needs are identified. So with promotion, we view that as beginning before even birth, and it continues throughout life. What we want to do is increase positive things for children and families, resources, positive relationships, and opportunities to succeed, as well as ensuring that they live in healthy and safe environments. For prevention, we want to prevent things that we know are negative factors for children's health and well-being. Chronic and toxic stress, exposure to violence, being in unhealthy environments, and ultimately even having insufficient opportunities. Those are all things that are detrimental to children. And intervening early. So when challenges do arise, that we address them early and that we provide resources and services as soon as possible so that families don't have to struggle. And ultimately, direct services are really, really crucial to the work that we're trying to accomplish. And there needs to be on our end cross-systems coordination and information sharing so that we're taking a holistic approach in our work so that the whole child and the whole family is served. Equity and social justice. We wanted to lead our conversation with this focus first because it's so important to the work that we're trying to do. Best Starts for Kids recognizes that persistent inequities exist, especially by race and place, and that in many places they're getting worse and threatening the collective prosperity of families in King County. With race, we want to recognize that the reason racial disparities and disproportionality exist right now in our country is due to historical intentional policies that have excluded people of color from opportunities and the ability to accumulate wealth and resources for their families and their communities. And at the same time, right now in our time, income disparity is an increasing challenge that we are all talking about every day and are acutely aware of. In government, we know that without a conscious effort to change the way we do things, government policies will only have the impact of perpetuating those inequities. As for place, we mean where you live, that where your actual zip code has an impact on your health and your access to resources and opportunities. King County is extremely geographically diverse, and Best Starts for Kids recognizes that both rural and urban areas have been underserved, and we also recognize that even in areas that are perceived to be very affluent, there continues to exist pockets of need. So how does equity influence our decision making? We want to say up front that we are on an ongoing journey. This is a continuous learning and improvement process, and we want to hear back from you any feedback and insights on the experiences that you have with Best Starts for Kids. And in the meantime, we want to make sure that everyone feels welcome to apply for Best Starts for Kids funding. We encourage applications from every single part of the county, and we want to invest in organizations that are reflective of and embedded in the communities that they serve. Here are some of the things that we're doing on our end to help support that work. One, we want to make applications more accessible. We want them to be straightforward and easy to read, and we hope that they have been. We are providing technical assistance to applicants so that we have people, consultants who are able to help you with your application, either just copy editing and proofreading or with concept development and just brainstorming. And if you're awarded with Best Starts for Kids money, we see our contracting process with you as a partnership where we work together to figure out how we can together succeed. And as part of that, we're making data and evaluation also a partnership that we will work with you to identify how you can track your program outcomes. So why are we investing early? Why are we looking at prenatal to 5 specifically? As you know, the earliest years of a child's life offers a unique window of opportunity to support lifelong health and well-being. 90% of brain development takes place in those first 5 years. And what we've also learned from brain science are that, one, exposure to chronic stress, lack of caregiver support, unhealthy environments, and violence can alter a child's brain development and negatively affect the way they behave and their capacity to learn. Conversely, feeling safe lets children know it's okay to explore their surroundings, knowing that they have a safe harbor to return to. And feeling loved helps them navigate tricky emotions and learn how to build healthy relationships with other people. These are all traits that we recognize to be key to success in both school and in life. We also want to say that, parents and caregivers need support. There's a cliche that raising a child is both tremendously rewarding and challenging. So we recognize that no matter who they are or where they live, families do best when they have social connections, when they have knowledge of parenting and child development, when they have social and emotional support, including really, really concrete support during challenging times. And ultimately, this allows children to model off the behavior of adults and develop their own social and emotional skills.
All right. Thank you, Victoria. So we're going to talk about funding the communities. So 50% of all the Best Starts annual funding supports healthy child development and family well-being. Best Starts for Kids, as you know, is an initiative aiming to support all communities in King County to ensure that babies are healthy and children thrive. As a government funder, Best Starts for Kids invests an average of $65 million a year, with 50%, again, 50% of the money going towards the prenatal to 5 work. The Best Starts prenatal to 5 investment areas will reach children and families where they are in those first 5 years. So in their homes, in child care settings, and in community to support healthy child development and family well-being. All right. So we're going to go into each investment area with you that you see here on the screen. There are opportunities for community-based organizations and that are either available now or opening any time between now and early 2018. For each strategy, when it becomes available, we will host a webinar and a meeting in the communities so you can ask your specific questions. Be on the lookout for this information and save the dates on our blog. So some of the opportunities are more focused or already closed, and we want to share these with you as well. The focused opportunities include some strategy areas that are in a research phase and therefore are limited to research organizations. Others are extension of already existing contracts. While these opportunities are not open to some of you, we want to be transparent in everything we do and want to continue to connect the dots across the prenatal-to-five strategies. And you'll also note here, Help Me Grow is currently under development and is a systems building effort and the work that's being done now will result in more opportunities down the road for community collaboration and funding opportunities. All right, so we're going to start out with talking about home-based services and how we're creating a continuum of services. So we're investing in home-based services, a type of family support. This is focused on expectant parents or parents with children ages birth to 5, where trained professionals provide services and supports for parents and their children where they live. We will create a continuum of home visiting services across the age groups, across geography, across diverse communities, and all levels of intensity, so that we can meet a range of needs in the community, as stated in the Best Starts for Kids implementation plan. Best Starts for Kids is funding many different models that are designed to improve outcomes for families and children of prenatal to 5, including some that have some substantial research behind them, and others that are newer, or may not have had the opportunity to have as much research behind them. So I'm going to talk about each of these different levels of evidence. Currently, we have a particular funding opportunity, one that is specific to evidence-based and evidence-based informed models. Examples of the eligible models available include some examples such as parents as teachers, the child-parent psychotherapy, or outreach doula, and there's many more. Evidence-based programs have they are well-defined models that have been proven through rigorous research design when implemented with fidelity. Evidence-based informed models use a documented model that have shown to produce positive outcomes. This RFP is open now and is due November 2nd, as you can see on the screen. So please refer to the blog for more information. We know that many communities are supporting services in their homes and that are not evidence-based or evidence-based informed. So we're so excited to think with all of you to have community-informed practices available. We will release an RFP in January of 2018 up to $2.4 million, where people can apply for these models that may not have as much evidence. So we'll be conducting community outreach to learn more from you and how we can develop this funding strategy to meet the specific needs of your community. So please stay tuned to the Best Starts for Kids blog and newsletter for updates. In our continuum of home-based services, we've already invested in some home-based services. The Parent-Child Home Program had a release for applications that was closed on September 18th. So $3 million annually was awarded in partnership with the United Way of King County. Parent-Child Home Program is an evidence-based model that Best Starts for Kids is supporting and in partnership with the United Way. And it supports parents of 2- and 3-year-olds through educational play, and caregivers develop their children's cognitive and social emotional skills. Currently, the United Way, in partnership with King County, is awarding those grants as we speak. Nurse Family Partnership, we sustained that program and expanded services to levels of 2000, or expanded service levels, which is very exciting. Nurse Family Partnership is for first-time moms, for low-income moms, where a nurse comes and visits 2 times a month. So as you can see, we have a wide variety of opportunities in the home-based services and a wide variety of models. This screen right here, this slide, is to help those partners most interested in applying for the home-based services funding. I'm not going to go into much detail now, but I want you to know the slide is available for your reference by viewing the recorded webinar, and that we'll post and share on the blog. You can also download the PowerPoint and participate and read about this on our blog. All right. So another funding strategy available is a community-based parenting supports. Community-based parenting supports are an essential way of partnering with communities and partnering with parents and caregivers. Community-based parenting supports provides community-based ways to decrease isolation, to increase the connection in the community, and improve access to geographically obtainable services. We know that we really want to work to try to serve families where they're at. This funding strategy really has 3 parts. The first being basic needs. Basic needs refers to items such as diapers, cribs, clothing, car seats, and many other items that family and young children need. We know that if families are lacking those resources, it's hard for them sometimes to move forward with engaging in other activities. So we really feel this is an important piece. We are going to open an RFP in October, mid-October, so that folks can apply for basic needs. In our community-based parenting supports, we have another opportunity. We will also be supporting Kaleidoscope Play and Learn. A Kaleidoscope Play and Learn group provides opportunities for parents and caregivers to come together to learn about ways to support young children's healthy growth and development, while also building social networks. Plan groups provide information such as referrals, education events for their parents and caregivers, and family, friend, and neighbor caregivers and the children in their care, ages birth to 5. This funding will be available to expand Plan Learn groups in your community. We will work with our partners at Child Care Resources to ensure that you have the support you need. And this RFP will be open in late October and will be for approximately $250,000. The third area funded by the community-based parenting supports covers a wide variety of supports for general parenting. We know families need information and support in multiple areas. Examples include prenatal and postpartum supports, immunization education, oral, auditory, or visual health, injury prevention, environmental health, and community-based parenting supports. Best Starts for Kids has a work group currently developing this strategy, and we anticipate an RFP being available in the winter of 2018 for approximately $1.5 million. All of us as parents need information, and caregivers need information. And all of us wish to know more about children's brain development and how we can nurture our children's growth. Some communities are already equipped with Parents with Vroom, a tool that incorporates brain building opportunities into daily tasks and events. Best Starts will support community-based organizations, community health workers to introduce Vroom to more families, as well as thinking about the adaptation of Vroom into different cultural contexts. There are more examples and other opportunities and tools that that look like Vroom, and we are working to think about this in early 2018. All of our prenatal to 5 grantees will have the opportunity to incorporate Vroom into their funding if they wish as well.
Thank you, Marcy. Okay, so moving on to childcare health consultation. We have an RFP out anticipated for early 2018. And what this is focused is on the fact that parents rely on others to care for their children, from childcare providers to family members, friends, and neighbors. And what BSK wants to do is support the design of a county-wide system where we have multidisciplinary teams of nurses, behavioral health experts, nutritionists, and other experts as defined by community to provide voluntary coaching and support to childcare providers and caregivers. So these teams are going to take a holistic approach to ensure that children's health and well-being are being well taken care of within childcare and caregiver settings. We're looking at things on levels, the physical and the social emotional. For physical health, we want to promote safe sleep practices for babies. We're looking at communicable disease prevention, as well as just ensuring that the physical environment that the children are in are safe and free of, for example, environmental toxics. On the social emotional level, we want to just promote a general overall environment where teachers feel supported and children feel nurtured. We want to make sure that we bring a trauma-informed and resilience-informed approach to how teachers support children through challenging times. And we will also be hoping to hear from communities to think about who should be part of those hubs, of those multidisciplinary teams based on what your communities need to help support caregivers and childcare providers. Developmental screening is a wide range of issue areas that help promote the development of children. So we are right now looking at an RFP to fund research organizations to conduct a landscape analysis. As many of you know, developmental screenings are enable parents, home visitors, childcare providers, healthcare providers, and other community members to monitor and celebrate children's developmental milestones. And when needed, these developmental screenings help inform families so they can access early promotion, prevention, and intervention supports at a time when children's brains are most capable of change. So what we're doing right now is we're conducting a landscape analysis to figure out what services are available in the county now, where they're taking place, where are the gaps and where are the opportunities, and what are the potential challenges that we might encounter in terms of implementing developmental screening universally across King County. What we're hoping for is from that landscape analysis to develop strategies and recommendations to promote universal developmental screening across King County to make sure that these screenings are available to parents and families in their languages and with workers who reflect the communities that they come from. While we're doing the landscape analysis, we will also be looking at funding pilot projects, and that will be coming out in late 2017. So the RFP that's out right now is specifically for research organizations, and later on you should be on the lookout for an RFP for developmental screenings for community-based organizations. Another area of infant and early childhood is infant and early childhood mental health. That's a big mouthful, and what it really refers to is social emotional well-being. And in infants and young children, it's the capacity of a child to develop close, secure attachments to adults and peers, to be able to learn how to experience, manage, and express a full range of all their emotions, and to be able to explore their environment and learn. And all of this is happening within the context of family, community, and culture. What we're hoping to do with Best Starts for Kids is to improve infant and early childhood mental health across a continuum of promotion, prevention, and treatment. And right now, as you can see on the slide, we have an RFP out, and we will have an RFP out in October, and that will be focused primarily, again, for research organizations to do a landscape analysis and to develop strategies, and for that analysis to form a baseline data of what services are currently available and how we can build on that. And in early 2018, be on the lookout for pilot projects where we will be looking at community organizations to help promote infant and early childhood mental health. Finally, I wanted to talk about early intervention services within developmental promotion. So as you can see on your slide, we already have awarded money. That was one of the first things that we did in 2017. And what these are contract extensions to existing providers. Early intervention services provide services to children from ages 0 to 3 for children with developmental delays and disabilities. And what they do, what they get is they get services that are designed to help children be active, independent, and successful participants in a variety of settings, in their homes, in childcare and preschool programs, and in their communities. And workforce development. So we have an RFP anticipated in January 2018 of $400,000 annually. And what we're hoping to do is to support teachers, pediatricians, healthcare workers, any sort of childcare, any sort of provider who serves both children and families, to make sure that they have the latest knowledge about child development, brain science, and trauma-informed care, so that they can treat children and families and support them in the best way possible.
So hopefully you're getting excited about this work, and I would just say this next opportunity, the Innovation Fund, is very, very exciting. County Council really helped to articulate this idea with strong community feedback and with support from our Children and Youth Advisory Committee. A plan was just passed to the County Council and will be refined over the next few months. We released opportunities for communities. We will release, opportunities for communities to apply for funding for the innovation work, where you might not see yourself fit into other funding buckets. So we know that evidence-based and evidence-based informed models do not work for all communities. We know that communities are really best at identifying their challenges and their solutions. So this RFP will be available in early 2018 with around approximately $1.3 million per year. So there are many examples of what this could look like. A successful project will advance the goals of really thinking about programs that may not fit, again, into the current other funding strategies. So this could be new practices or new models that do not have a research base. It could be an adaptation of some work that you're doing to meet the need of existing specific communities. It could look like a peer connection or a formal service or group to promote peer capacity building, learning together on a specific topic area, such as equity strategies or trauma-informed approaches. It could be a system connection, where you really have a grassroots idea that you can really inform and support policy development. So we will be looking at, again, releasing this in early 2018. So in 2014, the Public Health Seattle and King County funding shortfall reached a critical point, threatening the loss of maternal child health services. Best Starts for Kids investments brought the service levels back up to the 2014 levels, ensuring that Public Health Seattle King County provided to women, children, and families could continue and be available to community members through the life of the levy. Best Starts funding means that parents and children across the county continue to access necessary public health services. This work, our public health work, is so foundational to all we do, and an opportunity to connect families to additional resources that they may need. We heard from community, and we know that we want to ensure that families get the information they need at the right time. And again, we heard this from you. The coordinated network that we're working on growing is called Help Me Grow, which will integrate all of Best Starts for Kids supported services and systems, in addition to other work happening in the community. Best Starts is in the process of building a network of information hubs and community-based navigators to ensure families are fully informed about the resources available to them and can easily access this information in the language they prefer with providers who understand or reflect their cultural background. This is a exciting task, and it won't be easy, but we're in the beginning stages of building this, and we look to partner with many in the community to build out this so it works for all of us. Right, Victoria?
All right. We're nearing the home stretch here, so we'll be ready for questions very soon. I just wanted to jump in really quickly about data and evaluation. So Best Starts for Kids, the values that we bring to data and evaluation are partnership, collaboration, and accessibility. From the very beginning, we want to work in partnership with you to help you use your data to tell the best story possible about your organization and the work you do when you're looking to apply for Best Starts for Kids funding. And as we continue on our journey together, we want to collaborate together to see how we can help see movement and improvements in the Best Starts for Kids indicators. At the bottom of the screen there, you'll see a link that you can type in, and you'll see all the different indicators that we're hoping to see improvement on that cover a wide range of issues from child health to education to developmental promotion. You can see what all of those are and where we hope to see and make improvement throughout King County. And ultimately, we want to be accessible to you. When you encounter challenges or you have questions about how to gather data, how to build the infrastructure to be able to collect data, we want to be accessible to you and available to help support you in every way possible. One thing that everybody's thinking about right now as we are looking to get RFPs out the door is how can we use data to create a story about your organization so that you can have a strong application. I just wanted to let you know right off the bat that we are doing a separate webinar tomorrow on September 28th that's specifically devoted to providing tips and to answering questions about how you can use data in your applications. And it's going to walk through all these different steps. But generally, we want to look to support you in helping identify the story that you want to tell. What is the most powerful story about your organization, your program, your community that shows why your proposal can make a difference in your community? And what we're hoping to do is that as you tell the story, it can help you. It can help the people who are reviewing your application to get a real sense, a clear picture of what it is you do, what it is you plan to be doing, and how it will have an impact on the people you serve. The other half of data and evaluation is evaluation. Ultimately, what matters most is the impact that we all have on children and families in King County. So after we have made funding decisions, Best Starts for Kids evaluation team will work collaboratively with the organizations that have been awarded to identify what are the goals, what are the measures that you want to track to see improvement on. And we want to build a strong relationship with our awardees. We really, again, I want to stress that we view this as a partnership where we can discover potentially unforeseen challenges together, communicate openly about it, and build trust as we go through this journey together of hoping to improve outcomes for children and families. So staying connected. We want to make sure that we stay connected with you throughout all these different processes, and we want to let you know that we're going to have a presence at community events, that you're welcome to invite Best Starts for Kids staff to come and talk to your group and organization to answer questions you have. We're going to be putting out office hours. More information will be forthcoming on our blog. And we will also be looking at upcoming prenatal-to-five outreach events. So please stay tuned for more details. In terms of what's available on our website, there's going to be a list of resources that are FAQ, a frequently asked questions document, an upcoming prenatal-to-five one-pager that captures the work that we discussed in this webinar. And this webinar itself, it's recorded and you can go back and view it as many times as you want. And we will also be revising our Best Starts for Kids website. So you will see that coming up shortly. So just here are the websites and links for you to be able to stay connected with us. And I guess we can move on to questions.
And just remember, we'll have specific webinars for each of the strategy areas as they become available. Thank you. So we're unmuting right now so we can take questions live. So we'll just wait. It's a little quiet right now. So if you're going to unmute, you need to, or if you want to ask a question live, you also need to unmute yourself. Okay, so I see a question. I'm going to read it out loud. Are the funding amounts for each RFP the total per grantee or the total pot of money available? Very good question. So that is the total amount for each specific RFP. And within that RFP, there will be smaller dollar amounts awarded, and it will outline in each RFP what the funding ceiling and the floor would be. Thank you. Are there any additional questions? Okay, thanks for this. I was wondering if we can combine programs if they're for both the home visiting hold on just a second. So I forgot my glasses. I was wondering if we can combine programs if they are both for home visiting RFP. For instance, we would like to expand our Healthy Start program and our infant mental health program. That's a great question. If you are looking to expand your Healthy Start program, that would be specific to the home visiting RFP, and the expand your infant mental health program, that would be specific to the infant mental health program. However, if you do look in the RFP for the home-based services, there is some opportunities for training around infant mental health because we feel it's so valuable and important for all of our home visitors to have that information. So please look there. Hopefully that answers your question.
Let us know if not.
Yeah.
There's another question that says, if you receive funding from one RFP, can you still apply for other RFPs if you have a program or project that's a fit? And the answer is definitely yes.
Absolutely. You can apply for as many as you feel fit that meets the needs of your community. Okay. Do you know if the Kaleidoscope Play and Learn RFP can support existing groups or if it is just for new groups? That is a great question. We're working out the details for that now. So that would be available on our RFP or our RFP webinar up and coming. So I don't know the answer to that today, but thank you. Are there additional questions? So I'm going to wait just a few minutes, but we're going to go ahead and wrap up if there's no additional questions. Again, there's many different resources in which you can get your questions answered, and we are so grateful for the opportunity to have the time to share this information with you, and we look forward for ongoing community feedback. Anything else?